1. What is the primary purpose of the Professional and Linguistic Assessments Board (PLAB) test? To assess the English language proficiency of international medical graduates only. B. To ensure that international medical graduates have the necessary skills and knowledge to practice medicine in the UK. C. To replace the need for clinical attachments in UK hospitals. D. To determine eligibility for specialty training programs in the NHS. 2. Which regulatory body administers the PLAB test? A. British Medical Association (BMA). B. Royal College of Physicians (RCP). C. General Medical Council (GMC). D. National Health Service (NHS). 3. In the context of adult learning principles applied to PLAB preparation, which theory best explains why candidates benefit from problem-based learning scenarios? A. Behaviorist theory emphasizing stimulus-response patterns. B. Andragogy theory recognizing adults' need for practical, relevant learning. C. Social learning theory focusing solely on peer observation. D. Cognitivist theory prioritizing memorization of facts. 4. What is the format of PLAB 1? A. Oral examination with clinical scenarios. B. Multiple choice question examination testing applied medical knowledge. C. Objective structured clinical examination OSCE. D. Essay-based written examination. 5. According to Kirkpatrick's 4-level training evaluation model, at which level would measuring a PLAB candidate's actual clinical performance in a UK hospital setting fall? A. Level 1, reaction. B. Level 2, learning. C. Level 3, behavior. D. Level results. 6. What is the minimum IELTS score requirement for plabs-test eligibility, academic version? A. Overall 6.0 with minimum 5.5 in each component. B. Overall 7.0 with minimum 7.0 in speaking and listening, 6.5 in reading and writing. C. Overall 7.5 with minimum 7.0 in each component. D. Overall 6.5 with minimum 6.0 in each component. 7. When developing a curriculum for PLAB 2 preparation, which instructional design model would be most appropriate? A. ADDIE model, analysis, design, development, implementation, evaluation. B. Bloom's taxonomy exclusively. C. Kirkpatrick model only. D. SWOT analysis framework. 8. How many stations are typically included in the PLAB 2 examination? A. 10 stations. B. 12 stations. C. 14 stations. D. 16 stations. 9. In mentoring PLAB candidates, which communication technique is most effective for providing constructive feedback after mock OSCE stations? A. Sandwich method, positive, negative, positive feedback. B. Direct criticism without contextual explanation. C. Delayed feedback provided weeks after performance. Generic feedback applicable to all candidates. 10. What is the time duration for each station in the PLAB 2 examination? A. 5 minutes. B. 8 minutes. C. 10 minutes. D. 15 minutes. 11. According to Malcolm Knowles's principles of andragogy, which characteristic is most important when teaching PLAB candidates? A. Dependence on the instructor for all learning decisions. B. Subject-centered orientation to learning. C. Internal motivation and self-direction in learning. D. Delayed application of knowledge. 12. What type of scenarios are not typically assessed in PLAB 2? A. History taking. B. Physical examination. C. Surgical operative procedures. D. Communication skills and patient interaction. 13. Which assessment method best evaluates a candidate's readiness for PLAB 2? A. Written multiple choice questions only. B. Formative OSCE practice with standardized patients. C. Self-assessment questionnaires exclusively. D. Peer review without expert supervision. 14. What is the pass rate calculation method for PLAB 1? A. Fixed percentage of 70% correct answers. B. Relative ranking among all candidates. C. Borderline regression method or similar standard setting procedure. D. Subjective evaluation by examiners. 15. In curriculum development for PLAB preparation, which principle ensures content validity? A. Including only theoretical medical knowledge. B. Aligning content with GMC's Good Medical Practice Guidelines and UK Clinical Practice. C. Focusing exclusively on rare medical conditions. D. Excluding communication skills training. 16. Which mentoring approach is most effective for PLAB candidates experiencing test anxiety? A. Ignoring emotional aspects and focusing only on content. B. Cognitive behavioral techniques combined with structured preparation. C. Advising immediate test taking without adequate preparation. D. Comparing their performance negatively with successful candidates. 17. What is the validity period of a PLAB 1 pass before attempting PLAB 2? A. 6 months. B. 1 year. 2 years. 3 years. 18. Which communication model is most relevant for PLAB 2 consultation scenarios? A. Shannon-Weaver linear transmission model. B. Calgary-Cambridge Guide to the Medical Interview. C. Berlow's SMCR model exclusively. D. Lasswell's communication model only 19. According to Bloom's taxonomy, which cognitive level is primarily tested in PLAB 1 clinical scenario questions? A. Remembering factual information only. B. Understanding basic concepts. C. Applying and analyzing clinical information to make decisions. D. Creating new medical theories. 20. What is the GMC's stance on the number of attempts allowed for PLAB 1? A. Unlimited attempts. B. Maximum of 2 attempts. C. Maximum of 4 attempts within 3 years. Maximum of 6 attempts. 21. Which evaluation method provides the most comprehensive feedback for PLAB 2 preparation? A. Summative assessment at the end of training only. B. Continuous formative assessment with specific, actionable feedback. C. Peer assessment without expert input. D. Self-evaluation exclusively. 22. In the context of regulatory compliance, what must PLAB candidates verify before registration? A. Only their medical degree authenticity. B. Primary medical qualification, PMQ, identity verification, and English language proficiency. C. Their country's political stability. D. Personal financial resources only. 23. Which adult learning principle explains why PLAB candidates benefit from spaced repetition in study schedules? A. Immediate massed practice is superior to distributed practice. B. The spacing effect enhances long-term retention and retrieval. C. Learning occurs only through continuous study without breaks. D. Repetition is unnecessary for adult learners. 24. What is the primary focus of communication skills assessment in PLAB 2? A. Medical jargon and technical terminology usage. B. Patient-centered communication, empathy, and shared decision-making. C. Speed of information delivery. Demonstration of superior knowledge to patients. 25. Which framework is most appropriate for developing clinical reasoning skills in PLAB candidates? A. Hypothetico-deductive reasoning and pattern recognition. B. Random trial and error approaches. C. Intuition without systematic analysis. D. Cookbook medicine without critical thinking. 26. What is the consequence of failing PLAB 2 4 times? A. Immediate eligibility for retake. B. Permanent ban from GMC registration. C. Cannot attempt PLAB 2 again, must restart with PLAB 1. D. Automatic referral to specialty training. 27. In mentoring relationships with PLAB candidates, which characteristic defines effective mentor behavior? A. Maintaining hierarchical distance and limited availability. B. Providing directive instruction without candidate input. C. Active listening, guidance, and fostering candidate autonomy. D. Focusing exclusively on the mentor's own experiences. 28. Which principle of curriculum design ensures progressive difficulty in PLAB preparation courses? A. Spiral curriculum with increasing complexity and integration. B. Random topic selection without structure. C. Teaching advanced concepts before fundamentals. D. Isolated topic presentation without connections. 29. What type of validity is most crucial for PLAB examinations? A. Face validity only. B. Content validity, ensuring assessment matches practice requirements. C. Predictive validity alone. D. Construct validity exclusively. 30. According to the GMC, what clinical competency level should PLAB 2 candidates demonstrate? A. Consultant level expertise. B. Medical student final year level. C. Newly qualified doctor able to undertake Foundation Year 1 F1 duties safely. D. Specialty registrar level. 31. Which feedback model is most effective in post-OSCE debriefing sessions? A. Pendleton's model, what went well, what could improve, action plan. B. Criticism-only approach. C. Delayed feedback after several weeks. D. Generic comments without specificity. 32. What is the primary language requirement rationale for PLAB testing? A. To create barriers for international medical graduates. B. To ensure patient safety through effective clinical communication. C. To promote British cultural superiority. D. To reduce competition for UK medical graduates. 33. Which assessment principle ensures reliability in PLAB 2 examinations? A. Different scenarios and criteria for each candidate. B. Standardized patients, structured marking schemes, and examiner training. C. Subjective opinions without criteria. D. Random selection of assessors without training.